Do the Vikings play tonight?
Yes, the Vikings play tonight, so I have to root. Okay, got to root for the Vikings. Okay. Gary is a Vikings fan from Minnesota. His son's a cop. Where's your son, the cop?
In Rochester.
Rochester, okay. All righty. January 13th, 2025. Ask Doc Ellis. This is Kimberly, Federal Workers Comp, using an attorney, Tennessee. Permanently disabled, been on OWCP Workers Comp since 2011. Attorney I've had is retiring. Could you recommend reputable OWCP attorney in the 50 states? No. You probably don't need one. You just need a doctor to do a periodic report every year saying you're still unable to work. Right? You're on temporary total disability, permanent disability. You're getting either 75% or 67% of your pay tax-free till you die, and all you need is a doctor to say, yes, you're still the same. They may send him a form once a year. These are your job descriptions, and he puts down or she puts down what you can do. The government, they say we can't do it, and you stay in workers' comp. Okay, but you don't need to pay an attorney for that. Okay? So I'm glad your attorney's retiring. And by the way, there are very few attorneys who do federal workers' comp, and some of them. There's an attorney firm in Texas that won't even do an oral hearing. They advertise federal workers' comp and won't do an oral hearing. Now, the way you appeal things, you review the record, you get a senior claims examiner, you do an oral hearing, it's an informal thing. You can go to the Employee Compensation Appeal Board, but they don't even do oral hearings. I'm calling that legal malpractice to advertise that and not do it. Every time I've done an oral hearing, we've won. It takes about 15 minutes. Because, by the way, in federal workers' comp and in VA disability, when you go to the federal level, the Department of Veterans Affairs in Washington, D.C., the judges there are lawyers. They know it's fair through the vet. Same way when you go to the Employee Compensation Appeal Board and oral hearings, they understand that federal workers' comp law is pro-employee and you win. It's just a lot of claims examiners and certainly supervisors and people like that don't understand how fair the federal workers' comp law is. Okay, so just keep going on. And I have people come here from all across the United States for a report once a year. And I said, let's get somebody closer to home. I'll talk to your doctor and tell them how to do it, and they can, but they don't know how to bill for it because they need to bill for it so that the government knows it's a real report. Okay? But the government needs to have a piece of paper. And sometimes doctors feel funny doing that because there's nothing else to do except fill out a little form. Doctor, do it. It's important so they don't lose their money. Okay, this is Glenda, a federal workers' comp. Second opinion exam from Texas. Fell at work, torn my medial and lateral meniscus. That's a knee, by the way. Initially denied, surprise. Sent a second opinion, the claim was accepted for a permanent aggravation of the left knee. Had to go for another second opinion. How often do I have to go for a second opinion if the accepted injury is a permanent aggravation? That depends on your claims examiner. Now remember, a claims examiner has 12th grade education, no training in law, no training in medicine, and they got to respond in 30 days. Okay? And so sometimes it's just easier to ask for another second opinion. I've seen that happen. Just a second opinion. Government, you save stuff a lot of money if you made these claims examiners explain why they want a second opinion. Anyway. Example. 60-year-old federal employee on a walker, and his hips, knees, and ankles are accepted. He's on workers' comp, getting 75% of his pay tax-free. The nurse case manager would like to be on FERS, medical retirement, at 40% taxable. From 75% non-taxable to 40% taxable. Said, that's a great idea for the post office, but that'd be about the dumbest thing this guy ever did. Why would he do it? They don't like it. The post office, not the government. It's not the law. So they send him to 3 separate doctors at $4,000 to $5,000 a hit. I need to be on the other side instead of making what I make. Come on. And they all said he could work. Yes, he can work. But he gets to pick his doctor in federal workers' comp. And his doctor decides what you can do. Your doctor you pick in federal workers' comp, you select them. The government doesn't, and the government's hired asses don't get to do it. And these are the restrictions. Post that we don't have a job, so he stays on workers' comp till he dies, and they lost $30,000-$40,000. That happens all the time, government. If you want to save some money, give me a call. I'll charge you $1. I'll teach you how to fix this. All right. Okay. Now this is aggravation of the left knee 2 years ago. had to go for second opinion. They may be sending you once a year because they need that report. You need once a year see a doctor and have them send a letter to the e-comp a letter that you're still off work. A CA-17, you're still off work. And do it. And if your doctor doesn't know how, I'll show him. My staff can show him how to get a provider number and bill the government so you don't have to come to Poto, Godibo, Oklahoma, or Oklahoma City, and we can help your doctor do that and get those, because they need paperwork. And also doctors, insurance companies would call it padding the bill if you keep doing all this stuff and doing all these forms. Medicare might too, but the government wants it. They want documentation, which makes sense. You shouldn't just get a check every year just without being checked on. All right, okay. So how often do I have to go? It's up in the air. Okay. Jimmie, VA, secondary conditions from Kentucky. 67, came here in 2016, got 10% for tinnitus, 10% less wrist. My tinnitus, ringing in the ears is worse, yeah, over the years, et cetera, The max you can get for tinnitus is 10%, but you have now, you've been diagnosed for hyperacusis. In other words, it's really bothering you. Okay, that'll give you sleep apnea. That's 50%. That will contribute to depression. It'll contribute to anxiety. It'll make you crazy. All right, and all those things could be secondary VA claims from the ringing in the ears. Also, if you are a vet and you have tinnitus and you die of a cardiovascular disease like heart attack or stroke, then the spouse, usually a widow, can get a service-connected death pension, because tinnitus contributes to hypertension, which contributes to heart of the arteries, which gives you strokes and heart attacks. And you can imagine how fun it is to get a widow a pension. That's a fun day. But that's the VA law. It's very fair. Most doctors don't know it. You just start beginning mental health. Okay, there you go. So we add all those mental health conditions, and even bipolar. Now, bipolar is genetic, but it's aggravated by your tinnitus. So we put all those mental health things together, and you come up with a mental health impairment. Yeah, good. I'm sorry you're going through that, but yeah. Okay, however, there's one. The CP exam that we were done here was very well written. Okay, your letter list. Okay, and of course they turned you down. Okay, but then when you went to appeal, you win. So you got a VSO and reapplied the same report. That happens all the time. It depends on it depends on what rating officer got it in what state. If they're having a bad day, you get screwed. Because no one knows who it is, and you don't get to know your accusers. It's just awful. It's like you're in Russia and China. Okay. And it pisses me off when they hurt my vets. Okay, but veteran service officers, now, veteran service officers are free, American Legion, DAV, VFW, all those people, and every state has veteran service officers. They're free. Make sure you go through them. If you get a Nexus report from somebody like myself, make sure they look at it. Sometimes words change. Maybe I'm supposed to use accelerated instead of aggravated, because it morphs around. I'm always interested in what's working, and we're always learning. Okay, now also the recent Pact Act, toxic exposures, 75, 79, aviation firefighter. You've been around a lot of shit in the Naval Air Facility. Okay, a lot of burn pit exposures. Oh yeah, that's your lungs. Yeah, and if you get cancer, get your widow taken care of. PCB exposures, yeah. And on a lot of ships, not the new ones, but some of the older ships and shipyards have a lot of asbestos.
Yeah, it was like you were stationed in Italy.
Yeah, volcanic ash, and that'll hurt your lungs. That's like inhaling glass. Okay. My Sergeant stay focused. Yeah, you got to add those. I just don't know how to navigate this VA maze any longer. Join the club. Let your veteran service officer help you. Don't give up. But you always need a Nexus report. That's a causation report. But the doctor knows what he's doing. And not by a VA doctor or a VA nurse practitioner or a VA. No, they don't know how to do it. They're not trained. And there's a bias. Also, I have a doctor who works for me. One of the contracting companies the VA has doing CMP exams will send him a letter saying, you're finding a lot of extra conditions. Shouldn't you get a gold star for that? Be called a hero? not balled out for finding new things for a veteran. That's bullshit. Now, I don't mind insurance companies fighting you, but that's the government. That should be fighting vets. The VA laws, if it's the little bit, it's 100% covered. You shouldn't fight these people. I was talking to somebody a couple months ago that works as a job at the VA, and they get internal memorandums that doctors help veterans get their disability are called predators. They're called heroes, you dumb shits. Okay, that's 3. 4. Federal Workers Comp. Employee rights from Texas. Okay. OWC finally accepted a CA2, which is a chronic, like carpal tunnel, occupational illness. Appreciate your guidance through the process. That's my staff. They're phenomenal. Agency error. The CA1 delay. And they do that all the time. They sit on it. No one gets fired, so they sit on it. Okay? And so it had to be gone to a CA2, blah, blah, delay. And you were without compensation, health care benefits, you need support to go retroactively, get that going on. If you need a medical report, we'll be glad to do it. But that sounds like a employment EOIC complaint. That's not a federal workers' comp complaint. Okay. How should I enforce it? You have to file a Merit System Protection Board complaint. Separate or consequential claims. Separate claim for additional injuries sustained due to this administrative delay. What I would recommend, you can what's news. File a separate claim, get it, but before you file it, you get a causation report from a doctor like myself, and then we'll start off with, let's say we've got a knee, right knee, and a limp, and now my hip is bothering me, the consequential. We'll say, this is a consequential injury due to the right knee. This could be added to the accepted claim number, or a new claim number could be given. That at least gets the claims examiner in the mindset of which way do I go, not like I'm just going to deny everything. And of course you worked during that meantime, then that continue working contributed to it. It's adding is difficult, new claims are easier. Because it's a new claim, a new CA7, they have to address it. Upgrading is hard. We do upgrades very well, but it's harder. Children's Compensation Loss Consortium. I don't know if there's anything you can do about that, unless it's Merit System Protection Board. What's AI? What's AI's? Okay. They don't have an answer either. Family gets screwed. Okay. And 5. Okay. Push kids to work. All right. Okay, Robert from Georgia. How do I find a doctor to write a Nexus report? Google. Doctors writing Nexus reports. Just Google it. Doctors that do Nexus reports. And use the word Nexus, or VA Nexus reports. And now, there are some doctors that will charge, and firms and stuff, they'll charge up to $5,000. Okay? And then they want a piece of your disability. That should be illegal, certainly unethical. We charge $500 for a shoulder. A neck, we charge $500. Now, if you have nerves down both arms, the neck and both arms are $500. Noise and hearing loss is $500. Okay? So a lot of times you can go to the VA with your noise and hearing loss and just go through the VA system because it's an audiogram that decides it. Although, maybe that's not good advice. I've seen people with tinnitus and a hearing audiogram with a dip at 4,000, which is noise. It's not old age. Clearly noise. And they'll be denied 6100 noise-induced hearing loss. It should be 0, which is a big difference. Denied means you still have the burden of proof. You've got ringing in your ears, then you've got 6100 hearing loss. It's just, is it 0 or usually starts at about 20. But if you have 0, then you can go back to VA without having to see Ellis Clinic and pay money, and they'll do an audiogram every year or two, and then suddenly you'll be at 20%. If you know how to not let them defraud you, because the audiogram. This is the American Medical Association Guide's Evaluation for Impairment. This is the 6th edition. I'm an editor of the 4th edition. Blah, blah. Guy's got 2 hearing aids. You have to yell to have him hear you. put your hands over my mouth. He can't hear unless he's reading my lips. Bad hearing loss. VA rates him at 0. Because they said his audiogram, which in the book is 35% or so, he has 96% speech discrimination. In other words, he understands words that I say. That's bullshit. That's just pure fraud. Okay, but what happens is, it's supposed to be, the word's supposed to come from a CD-ROM called a Maryland CNC, so Beltone can't do that test for you. And it always comes back 96%. So what's happening, the audiologist is repeating the word till you understand it. Don't guess. If you don't understand the first time, you say, ma'am, I didn't understand the first time. Now, Dr. Ellis said if you keep repeating it and it didn't come on a CD-ROM, I should call OIG and file criminal charges against you. Stop this. And we're probably have to, if I ever get somebody by me and we get a lawyer in there, we're going to go after somebody, one of these audiologists, and zing them. Stop this fraud. And it happens all the time. Every time I bring that up at a webinar, everybody's, yeah, it happened to me, it happened to me, it happened to me. So government, quit screwing these vets. And then I won't have to get so mad. Okay, here, that's Nexus in your area. Okay, and that was 5. 6, Gary from Pennsylvania, VA. Secondary conditions. United States Navy, 24 years, God bless your heart. Rated at 90. I've applied for osteoarthritis, stage of both knees. Now, how could that happen? Walking on that nice soft steel on those ships. Of course, it's service connected. And okay, right knee was 20, so that means the other knee is covered because if your knee 20, in other words, if you're 16 years old and on the beach and you've got 2 flip-flops and you forgot one, and you're just that far off, you go find it because just that far off. If a chiropractor can do that much your back, oh my Lord, it's like magic. Walking upright's not good for your back and your knees and your hips, and so if you're a little cattywampus, it's gonna make it worse in the future. And that makes it service connected. Supplemental claim for the left knee, just file a left knee claim. Get a Nexus report for your left knee, and in the meantime, get your right knee approved. You got 20% of your right knee. Now, if you have a meniscus, that's 10. If you have a ligament that's loose, that's 10, 20, or 30, whether it's mild, moderate, or severe. And that's just a little exam takes 5 seconds. I got 10% from a knee. No, you got screwed out of 30. And then see if your hips and back are covered. All right. But that could be if you just had flat feet. All right. Okay, pain down the leg, that's probably your back. Maybe your butt muscle and pinching the sciatic nerve. But that's the back. That's the secondary claim. And that's probably your back. So you rate your back for the disc in the back, the arthritis in the back, and the spinal nerve that goes down your leg. Should I wait? No, wait till my left knee is granted. No, do it. File it now. File it now, even if you don't have a doctor's report, so that we can go back to the day you filed it and they pay forward. Do not delay, and never start over. I've heard some veteran service officer, it'd be easier to just start over and do a new claim. No, I want to go back to the day I filed. It's called a Niemeyer, veteran named Niemeyer, and so you pay me forward. It's a lot of money, especially if it's 20 years old. Okay, I'm planning to request an appointment with you for Nexus and DBQs. Sure. Just go to ellisclinic.com, click appointments, fill out the stuff, send the records, and we'll call you, give you an appointment. Sleep apnea. And now, if you've gained weight from that knee, sleep apnea is covered. If you have tinnitus, sleep apnea is covered. Still waiting for the DBQ. You don't have to have them, but they help. Okay. You need the Nexus report more than that. But anyway, it's not going to hurt if you get a DBQ. It's worth an extra $300. So that is 7. Okay. This is Marie from Utah. Federal Workers Comp. Have septic injury in 2006. Acquired aggravated spondylolisthesis. That's where the bottom vertebrae is. That's a major back problem. Pain in your legs, hips, surgery not recommended. You've had physical therapy, chiropractic massage. Okay, they just denied therapy this January. You need to get your treating doctor to write a medical rationale report, a letter of medical necessity doing that. And if you can't do it, have them referred to Ellis Clinic. We'll write the magic words. That doctor, you need to get physical therapy. You need that all your life. So your claims examiner's got a hair up her butt and fighting you. So get that, so that you get a doctor saying that. Saying evidence is insufficient. It probably was. In other words, it's really there. It's all in your e-comp account. But the claims examiner wants a letter of medical necessity. Okay, we'll do it. Been through second opinions, last one in 2003. So tired of fighting with him. But you need physical therapy. You're going to be bound up. You'll play the game. Okay? Pain medications, they're supposed to pay for all that. Now, so if your doctor doesn't know how to file federal workers' comp and get you your medication, trying to find one that does. It's going to be extremely difficult if you have a Schedule II drug for pain to find a doctor that will treat you under federal workers' comp. You may have to pay for that out with your health insurance. Don't get tired of fighting. It's the law. Okay? And if you're a Christian, this is good training to judge angels. Read Corinthians. The Corinthians were doing most of the epistles. Paul's balling people out because they're screwing up like we do now. So this is the flesh sin. Jimmie Swaggart, Bill Clinton. It easy to see sin. And he writes to the saints at Ephesus. You're going to heaven. Quit that. Not you better watch out. You better not patch. You're not going to get Christmas present. You have to earn salvation. And the Baptists say you can't earn salvation. They're wrong. You can be perfect and go to heaven. Nobody in this is. Jesus went that way, and he went the faith way. The rest of you go by faith, which is a gift anyway, or no way. Okay. Don't you know the saints will judge the world? Don't you know that we will judge angels? And so when America, I don't know about Europe and Asia, but American Christians, when it hits the fan, are surprised. The Bible says, do not be surprised if the fire of deal come upon you. Jesus learned obedience by what he suffered. A couple years ago, I go to church and say, Lord, am I supposed to pray for Satan? He's been the best Sunday school teacher. No, we're not. It's not redeemable. But the trials of life are training us to judge angels, which means I'm going to live to be 150 because I need a lot of training. Okay. Second opinion, last one, 2, 3, and 5. You go. If you don't go, they'll cut you off. And remember, the claims examiner may need something. If your doctor would send something in periodically, a CA-17, like every 6 months or at least once a year, and bill for it, and get it in the e-comp, so it's in front of then the claims examiner, okay, here's something. And then you don't have to go to all these second opinions, because they're required to get the information. And I said earlier, Blue Cross Blue Shield insurance companies that fight you for doing all these reports, you're padding the bill. Government needs that, so get a doctor that'll do that for you. Or say, Doc, we want an occupational medicine referral, and I'll do the stuff, and you guys do the treatment, and you bill yours, and I'll bill mine. It doesn't cost you, the doctor, anything. It doesn't cost you anything. Here's Mike. Does the state of Oklahoma have statute of limitations for workers' comp records, chiropractic records? Because, Lord, I haven't done state workers' comp for 100 years. Although I used to be the guy when the State Medical Association put in HMO, I was the head of the workers' comp division. But I've restricted my practice to federal workers' comp and VA because we're swamped. Because no one knows this stuff. A lot of people know state workers' comp. Here's the AI said Oklahoma for filing a workers' comp claim is 2 years. Record retention, it varies. Okay. Chiropractic is usually 5 years. Okay. We'll be contacting you. Love your spirit. Okay, good for you guys. Nexus waiting for approval for flat feet. Come on in anyway. You don't need approval. You need hip and back pain. You don't need approval for that. If you tell me that you had flat feet before you went into service and they're aggravated that much, then those flat feet are covered. Okay? But let's say your flat feet are just flat, and then we have you marching and carrying a backpack, then you're going to have marching and giving you a backpack is going to hurt your back, knees, and hips, and ankles, feet. And have flat feet, it's going to make it worse because the mechanics are wrong. Right? But it's your marching in the backpack. Now, because you work for a living. Now, I was drafted as a doctor, and I remember down at Fort Sam Houston, we had 6 hours of drill. 3 of them were lecture. And we're out in the parade ground. Here's a major, which a bunch of us nerd doctors trying to get us how to teach us how to do an about face. I thought he was going to break his jaw trying not to laugh. Okay, doctors are just necessary evil in the military. Okay. Glad I got drafted. That was one of those God deals, because now I can help my vets and I can help my federal employees. Great training. Okay, now find a doctor at Nexus, just Google. Okay, that was 8.
No, that was a 10.
That was 10, so okay, 10. Okay, now here's 11. Mr. B, the laws changed about who can fill them out in 2025. Yeah, that's true. Now they're letting, of course, MDs, DOs, nurse practitioners, PAs, psychologists, and the chiropractors for musculoskeletal spinal conditions. All right, so yeah. And if you're doing telehealth, you can do telehealth DBQ. DBQ is not required, but they help. Think about it. The person doing the rating, like in Oklahoma, they're at a station in Muskogee, Texas, there's a station in Waco. All right. The form just is easier to read than a narrative report. The narrative report is more powerful if it goes to appeals. And if you go to Board of Veterans Appeals and Google Ellis, and they'll say, based on Dr. Ellis' report, remand it, start over. Based on Dr. Ellis, start over, because we tell the truth. We had a guy whose PTSD was dropped from 50 to 10 without an exam. And in the report, I said the veteran seemed to be upset that a doctor lowered his 50 to 10 without examining him. I've explained to the veteran he should not be upset. The greatest doctor ever born is able to do that without examining. I'm not that good. I had to examine him. By the way, his PTSD is 70. But that's the kind of bullshit you put up with.
You lost the last
lost
page whenever I...
Oh, 12. Okay, 12. Okay.
It.
Thank you, Dr. Ellis. I have osteoporosis and back pain and splint on my L5, right? Diagnosed sciatica. Yeah, if it's, that's Nancy's. That's covered in federal, and that's covered in the VA. Yeah.
It's more of a statement.
Yeah, but you can file if your work or your military time caused any aggravation, it's covered. It's just like when you're older, you're going to have more injuries when you're going to work older. But VA and federal law is very fair. Now in Oklahoma, state law, you got to be 51% to cause it. It depends on the system in the state and everything else. But federal and VA are ridiculously fair. No one knows the law. And of course, the big problem is pretend like I have a white coat on as a doctor. We're not trained in legal medicine, so we screw things up. God bless everybody.
Thank you, Doc.